Welcome back. In this section, we're going to be talking about hematologic and renal emergencies. The topics we're going to discuss is the hematologic system and the renal system. Let's start out with the hematologic system. The hematologic system. First, we're going to talk about blood. It represents its own organ system. It has specific functions. So it controls the bleeding by clotting. It delivers oxygen to cells, and it removes the carbon dioxide from the cells. And then it has the removal and delivery of other waste products to organs that filtrate and remove them. So remember, controlling the bleeding, delivering of oxygen to the cells, and removal of carbon dioxide and other waste products are all functions of the blood. So it is made up of solid components, red blood cells, white blood cells, platelets, and suspended in plasma. And then medications can affect some components of that blood. Next, we'll talk about blood clotting. So it's the aggression of platelets is the body's most rapid and initial response to stop the bleeding. Clotting factors are a group of proteins produced in the liver and released into the bloodstream. Once activated, clotting factors form clots through clotting cascades. Next, we'll talk about coagulopathies. It is abnormal clotting of the blood, and it can occur when the body forms clots too readily or the patient clots way too slow. So certain diseases make patients prone to poor clotting. For instance, advanced liver disease, hemophilia, and von Willebrand disease. Identifying patients with coagulopathies. A thorough patient history becomes more important when assessing patients with suspected clotting disorders. A critical aspect of being able to manage patients with potential coagulopathies is identified that the patient is in fact at risk for abnormal bleeding based on past medical history of the medications being taken. So for example, patients with a history of dysrhythmias called atrial fibrillation are commonly on blood thinners. So many EMTs have traditionally not made a priority of obtaining a sample history during that assessment of trauma patients. In fact, it is particularly important to ask all trauma patients that you care for if they are on any blood thinners as a part of your assessment. Care for patients with coagulopathies. So the emergency treatment is to take appropriate standard precautions. Perform a primary assessment and care for any immediate life threats. Obtain a history from the patient and identify which specific blood thinning medication he or she is taking or which bleeding disorder they suffer from. Then you want to notify the hospital as early as possible. You want to monitor the patient for the development of the signs and symptoms of shock or decreasing mental status. Administer supplemental oxygen if the patient appears to be in shock or has a decreased mental status. And then transport to an appropriate receiving facility. Deficiency in the normal number of red blood cells in the circulation is called anemia. There are many reasons that a patient can become anemic. So acute anemia may be the result of trauma or sudden massive bleeding from the gastrointestinal tract. These patients may rapidly exhibit signs and symptoms of shock or hypoperfusion, such as a rapid pulse, cool, clammy skin, and eventual hypotension. Chronic anemia occurs over time and can be caused by conditions such as recurring heavy menstrual periods, slow gastrointestinal blood loss, or diseases that affect the bone marrow or structure of the hemoglobin molecule itself. Patients with chronic anemia will appear more pale than normal. It is because it's a lack of circulating red blood cells. They often complain of fatigue and shortness of breath with exertion because of the lack of oxygen being delivered to the body's cells. So only after a prolonged period of time will patients with chronic anemia exhibit signs and symptoms of shock. One of the best ways to assess for chronic anemia is to examine the color of the patient's conjunctiva, which is on the lower eyelid. The anemia patients will also have very pale conjunctiva as opposed to the red-pink color seen in normal patients. Sickle cell disease is the next one that we'll talk about. So, sickle cell anemia is inherited disease in which patients have genetic defects in their hemoglobin that results in an abnormal structure of the red blood cells. So, the sickle cell disease is most commonly occurs in patients of the African descent, occurring in about 1 to every 365 African American births. So, sickle cell disease results in sickle cell anemia. Because of the abnormal structure of the red blood cells, it results in the premature destruction of that circulation. So again, it's a genetic disease affecting the red blood cells. It most commonly occurs in patients with African descent. Its defective shape resembles a sickle, and the cells have a short lifespan, leading to chronic anemia. Complications can be destruction of the spleen, sickle pain crisis, acute chest syndrome, priapism, stroke, and jaundice. It is estimated that 1 in 13 African Americans have the sickle cell trait. Sickle cell trait does not always lead to complications, though. It's possible to lead a normal life with sickle cell traits. You want to administer supplemental oxygen, monitor for inadequate respirations, and signs of hypoperfusion. You want to transport to a stroke center if stroke is suspected. Now we're going to move on to the renal system. On to the renal system. So the components are 2 kidneys, 2 ureters, and 1 urethra. The kidneys are essential for life. They filter the blood, remove certain waste products, excessive salts, and excessive fluids, and they maintain a fluid balance. So remember, the renal system is made up of 2 kidneys, 2 ureters, and a single urethra. It is responsible for the filtration of the blood and the removal of certain waste products, excessive salts, and excessive fluids from the body. Diseases of the renal system may affect different portions, and it ranges from minor to very life-threatening. Next is the urinary tract infections. It is most common disease that afflicts renal and urinary system. It's caused by bacteria. It's usually limited to the bladder. It causes pain and frequent urination. If left untreated, it can result in pyelonephritis. The UTI ascends up the ureter into the kidneys. Next is kidney stones. It's usually made of calcium and formed within the kidney. When in the kidney, they usually cause no symptoms. When they become dislodged, it can cause severe unilateral flank pain, and patients may report nausea and vomiting. Patients with urinary catheters. So the need for a urinary catheter can be because of obstruction of bladder outflow and a neurologic disorder. These patients use urinary catheters to drain urine. It's commonly inserted in the urethra and may be placed through the skin. Complications of a UTI and local trauma at the site of catheter insertion. Renal failure. It occurs when kidneys lose the ability to adequately filter and remove toxins. Acute failure typically results from shock or toxic ingestion. Chronic failure may be inherited or secondary to damage from the uncontrolled diabetes or hypertension. Next is end-stage renal failure disease, also known as ESRD or ESRD. It's irreversible renal failure. It requires dialysis, either hemodialysis or peritoneal dialysis. 90% receive hemodialysis in specialized centers. A vast majority of more than 450,000 Americans are on dialysis who are treated in a dialysis center undergo 3 treatments a week, each lasting 3 to 4 hours. Only 8% treat themselves at home. ESRD patients often rely on EMS for transport to and from dialysis. So at some point in your career, you will transport an ESRD patient and deal with the complications of kidney failure. Next is hemodialysis. The patient is connected to a dialysis machine that pumps blood through specialized filters. 2 large catheters create a circuit by which blood is removed from the body, filtered, and then returned to the body over several hours. So there's two port catheters that are inserted into the major vein in the torso. An AV fistula is it's surgically created and connects the atrial to the venous blood flow. Here it shows how hemodialysis works. So there's two types of access to blood circulation. So there's a two-port catheter or the AV fistula. Its characteristics thrill when palpated. Here is a two-port catheter for hemodialysis inserted into a major vein of the torso. Here's an AV fistula, surgically connects an artery and a vein in an extremity. Next is peritoneal dialysis. It uses peritoneal cavity's large surface area. Special fluid is infused into the abdominal cavity and left for several hours to absorb waste and excess fluid. And then the fluid is removed and discarded. So first you have a continuous ambulatory peritoneal dialysis, a CAPD. It's where the gravity exchange process is repeated several times a day. Then you have the continuous cycler-assisted peritoneal dialysis, which is called the CCPD. It's where the machine is used to fill and empty the abdominal cavity while a person sleeps. Here it's showing a peritoneal dialysis catheter. Medical emergencies in ESERD are where they have medical emergencies encountered in patients with the ESERD can be broadly divided into two groups. One is those that arise from the loss of a normal kidney function, and two, those that are complications of patients' dialysis treatments. So a vast majority of dialysis patients have other underlying diseases such as diabetes and high blood pressure. Complications of ESERD are usually related to the patient missing dialysis. They present with signs and symptoms similar to congestive heart failure with shortness of breath, edema, and electrolyte disturbances. So how do you care for ESERD patients who has missed dialysis? So for the ESERD patient who has missed dialysis, you want to assess their ABCs, obtain vital signs, place the patient in a position of comfort, administer oxygen, consider the use of CPAP, monitor vital signs closely and have an AED ready, and transport to facility capable of dialysis. Be certain not to take a blood pressure on the same arm containing a fistula, as you may damage it or you will damage it. So patients are usually very aware of this, but if your patient is unresponsive or not able to talk, you will have to assess this for yourself. So again, just make sure that you are not taking a blood pressure on the same arm that is containing a fistula. Complications of dialysis can be bleeding from the AV fistula site, clotting and loss of function of the AV fistula, bacterial infection and blood due to contamination at the AV fistula or dialysis catheter site, which can be included in the peritonitis. So again, advanced life support will be an important resource for complications associated with dialysis patients. So how do you care for ESERD patients with complications of dialysis? So first, assess their ABCs, control their bleeding. You want to use direct pressure, elevation, and hemostatic dressings as needed. If the bleeding cannot be controlled by other means, a tourniquet should be applied. And then again, administer oxygen as needed. You want to treat for shock, keep the patient supine and warm, and if peritonitis is suspected, you want to transport dialysis fluid for confirmation. And last is your kidney transplant patients. So kidneys are the most commonly transplanted organs. Approximately 21,000 happen per year. Patients spend their lives on special class of drugs, which helps prevent organ rejection and increase susceptibility to infections. Let's go over a quick chapter review. Blood delivers oxygen to the cells, removes carbon dioxide from the cells, and controls bleeding by clotting. Blood consists of red blood cells, white blood cells, platelets, and plasma. Anemia is a deficiency of red blood cells in circulation. Sickle cell anemia is an inherited disease in which a defect in the hemoglobin results in a sickle shape to red blood cells. This misshaping inhibits movement of the red blood cells through capillaries, causing sludging and blockages in the smaller blood vessels, causing chronic anemia. The renal system is comprised of the kidneys, the ureters, the bladder, and the urethra. The kidneys perform a vital filtering of the blood to remove waste products. They also help maintain a water balance within the body. Problems with the renal system include infection, kidney stones, and renal failure. Renal failure is a condition in which the kidneys are unable to normally filter waste and provide a balance of fluids and electrolytes in the body. Dialysis removes excess fluid and electrolytes from the body by filtration. Dialysis may be performed in either of two ways: hemodialysis or peritoneal dialysis. Hemodialysis at dialysis centers is generally performed 3 times per week. Peritoneal dialysis is done at home and is usually done several times a day. Major complications in patients with end-stage renal disease can occur after the patient has missed dialysis appointments from infections or as a result of bleeding from hemodialysis access sites. Remember, blood has specific cellular components. Abnormal blood cells can significantly affect patients. The renal system is critical to maintaining homeostasis. Renal failure can be chronic or acute, and end-stage renal disease is managed through dialysis. Questions to consider. Does my patient have a history of sickle cell disease or ESRD? Does my patient have an AV fistula? Will I need to make an early request for ALS because of the complications from a missed dialysis appointment? Critical thinking. You have a patient who is transported routinely for dialysis 3 times per week. She was sick and canceled the trip yesterday. Now she calls saying she can't breathe and feels like she's going to die. Is it possible that she has a legitimate complaint after missing dialysis by only 1 day? So dialysis is a critical function for patients in ESRD. Missing even 1 appointment can be a life-threatening emergency. The kidneys are essential to eliminate toxins and regulate water in our bodies. Without dialysis to replace the lost function, this patient's body has no way to rid itself of those dangerous toxins.